Hello everyone. In this video we will talk about the 9 joints of the lower extremity. I will speak out the joint's name, its ligaments and its special features if there are any. The articular surfaces of the joints, the type, shape and range of motion will only be blended in. The pelvic girdle is held together by symphysis pubica and articulatio sacroiliaca, which is stabilized by ligamentum sacroiliacum anterior, interosseum, and posterior. The articulatio coxae has its joint capsule attached to the labrum acetabuli, the linea intertrochanterica, and 1 cm above the crista intertrochanterica of the femur. There are also 2 intracapsular ligaments, ligamentum transversum acetabuli and capitis femoris. The other ligaments are ligamentum iliofemorale, whose apex is attached to the iliac portion of the labrum near the ziai, and its base along the linea intertrochanterica. Ligamentum pubofemorale, that runs from the crista obturatoria to the lower aspect of the linea intertrochanterica, and ligamentum ischiofemorale, that runs from the ischial part of the acetabulum posteriorly to the femoral neck to attach to the trochanter major. The knee joint is discussed in a separate video, since it is the most complicated joint in the human body. The tibia is connected to the fibula by 3 joints: articulatio tibio-fibularis with its ligamentum capitis fibulae, syndesmosis tibio-fibularis intermedia, which is made of membrana interossea cruris, and syndesmosis tibio-fibularis inferior, which is made of ligamentum tibio-fibulare anterior, posterior, and transversum. Next, we have the articulatio talocruralis. It is stabilized by ligamentum collaterale mediale with pars tibiotalaris posterior and anterior, tibio-calcanea, and tibio-navicularis, as well as ligamentum collaterale laterale with pars fibulotalare posterior, anterior, and fibulo-calcanea. Lastly, we will talk about the articulatio pedis, which is a collective term for 5 types of joints. In order to memorize these types with ease, we need to remember that the foot is made up of 3 sections: the tarsal bones, the metatarsal bones, and the phalangeal bones. Now add the prefix inter and you have the corresponding joints: articulatio intertarsalis, intermetatarsalis, and interphalangealis. The last one with the subtypes proximalis, distalis, and hallucis. Now, if you go 1 level above, you have the joints next to the 3 sections: the already mentioned articulatio talocruralis, the articulatio tarso-metatarsalis, and the articulatio metatarso-phalangealis. The ligaments have the same name as the articulations. Because of its extent, the intertarsal ligaments won't be discussed in this video. All articulations have a palmar ligament. All articulations have a dorsal ligament, except the articulations with a phalangeal in the name. They have a collateral ligament. The intertarsal and intermetatarsal articulations also have an interosseous ligament, and the metacarpophalangeal articulation also has a ligamentum metacarpale transversum. Alright guys, that's it for the joints and ligaments of the lower extremity. Let me know in the comments if you have any questions or if something is unclear. So, thanks for watching and see you next time.